Are you suffering from arthritis on your knees? If so, how do you manage arthritic knee pain effectively at home? Let's get into the video. Howdy guys, this is Karthik, physiotherapist. Welcome to my channel, Karthik Physio. How one can manage arthritic knee pain at home? Because arthritic knee pain can be long lasting and people may have flare-ups at times, and they may have a period of time where they may have some dull achy pain but not an acute flare-up. So the management would be different when you have an acute flare-up, when you don't have one. When you have acute flare-up, you can manage that acute pain with ice, rest, and minimal movements. So after 72 hours or after the acute flare-up subsides, so when do you know the acute flare-up subsides? When you see the swelling goes down, when you don't feel warmth on your knee joint, when there is not any redness or minimal redness present on your knee joint, that means the acute flare-up is subsiding slowly. Then that means it's coming out of the acute stage. For some people it can last for weeks. So at that time, it's better to stay away from the heat. If you see the signs of acute inflammation, the heat is a no-no. If you see the acute flare-up is gone or is subsiding, and as I said, you have only the dull achiness present, and maybe odd stiffness present, then heat can be a choice for treating that pain. How one should apply heat? Before you apply heat, make sure your sensation is good. All you have to do is, if you cannot feel the heat at all, or you can compare with the other leg, maybe you can load some hot water or something on a test tube or something like that. Just put that on the top of the skin and feel and make sure they can feel the heat sensation. Because even a constant moderate heat can cause burns on your skin. And therefore it's important to figure out if you have the good sensation of heat. So the recommended heat would be a moderate heat for longer time, a sustained heat, not intermittent heat. It's better to leave it for 15 minutes. Make sure to check your skin in between. It's not causing too much of redness or any burns on your skin. So heat is an approach to control a chronic pain, which is dull, achy in nature. Along with the heat, you can start working on your kneecap. I made another video about how to relieve stiffness, especially when it is stiff in the morning. When your knees are stiff and hard to move in the morning, there are a few techniques which can help ease your knee stiffness. I put this link on the description as well. When you have an acute flare-up with a lot of pain, a rest is usually okay. However, once the pain starts to ease out, it's important to move your knee joint, or maybe to follow a course of exercises. Just movements, frequent short sessions of movements throughout the day can help ease your knee stiffness and pain. And moreover, a walking program. How to do a walking program if you have arthritis? There is two things you have to remember. One thing is, if you're standing for a longer time, it's not good for an arthritic knee joint. Okay, so walking. How come a walking can happen without standing? Of course, yes, you have to stand for walking. But when you are standing, the loading of the joint going on constantly through the knee joint. When you are walking, the weight bearing is not going constant on both of your legs. So your one leg is offloading, the other leg is loading. So you're doing that in an alternate manner. So walking program is therefore recommended for people with arthritis. There are a few exercises if you are a senior or if you are a middle-aged man or a middle-aged woman who can do some specific exercises at home to keep your muscle strength. The more the muscles are strong, the better it's for the joint, because the muscle can take the impact which is going towards the joint. So the impact is less on the joint, so the damage would be less on the joint as well. The arthritis is not curable. However, you can manage the flare-ups and pain at home. If the pain and stiffness is not manageable at home, to consult a physiotherapist. And if the cartilage damage is extensive, and if the pain is excruciating and it's really hard to manage your daily activities, then surgery would be the last option. I hope this video is helpful for you. If you like this video, please hit the like button. Feel free to share this video to whomever it may fit. Until I see you in the next video with more information. Bye from Karthik. Thanks for watching. Have a nice day, guys.